Hello, my name's Kevin Redmond. I'm the advanced nurse practitioner for safeguarding children, covering mental health services across the northwest of England. In terms of HSB, harmful sexual behaviour, the role of health agencies is massive. The NHS is a web across this country. We are essentially the front door to people, from the very low-level concerns right up to high-end safeguarding concerns. It doesn't matter to us. Everyone walks through our front doors. So the role is about identification. Predominantly, these people are coming through the doors. That's our opportunity to identify people who are presenting with behaviours, symptoms, whatever it may be that falls under that harmful sexual behaviour remit. It's our role to be picking up on that and to be signposting and supporting people through the right pathways to address that type of behaviour. Certainly, and it's an absolute that we recognise that in services. It can be hard, don't get me wrong. I suppose when you hear to read or to have presented to you a case of harmful sexual behaviour, quite abusive, can be manipulative in terms of how they access victims. The reason I'm saying this is it's very easy to see all of that harmful behaviour in an adult context, and we attach them type of behaviours to someone who knows what they're doing, to someone who should know better, and it's absolutely not about that. If a child is presenting with sexualised behaviours beyond their developmental remit, there's a reason for that. They simply shouldn't. If a child is developing at the age and the appropriate stage of development that they should be, the sexualised behaviours will be appropriate. These children can have experienced domestic abuse, neglect, the environment, the adverse childhood experiences that they've experienced contributes to their development, and the development becoming skewed, and that's when you start to see these abnormal sexual behaviours. So it's not all about sexual abuse, but certainly the children have suffered adversity. I always think that they've suffered adversity to be presented in a way that is so beyond their normal developmental trajectory. These are children, and while they're children, there's hope that we can somehow revert them back onto a path of normal development and have a better outcome, get rid of this, allow that child to see why their behaviour isn't the way it should be, what it is that impacts on other people, and ultimately why it's harmful. If we can address this now and support children in the right way, support families in the right way, and divert the path of harmful development back onto childhood development, we can solve a great societal problem that's coming in a few years' time. It's utmost important that we do that now, and people start recognising the importance of addressing harmful sexual behaviour now.